everyone. My name is Dr. Megan Yim. I'm a chiropractor here at VitaCare Natural Health, and today I'm also acting as interviewer. We are conducting a summit, a series of interviews on beauty from the inside out. You know, as I get older, when I was younger, I didn't really care about putting on sunscreen or taking care of my skin. And it seems like every year goes by, I'm like, oh, that's a new wrinkle, or I should really be layering on a bit more sunscreen. I know that a lot of people are concerned about taking care of themselves, and it seems like more and more people are taking a more preventative approach, a more proactive approach to their health, and especially in terms of their physical appearance. Physical appearance is what you present to the world, so obviously you want to look and feel your best. I know a lot of women in particular put their kind of their self-care lower down on the priority list. You know, you take your work and your family kind of above you, and that is not necessarily always the best approach. You need to take care of yourself so that you can take care of other people. So in that vein, I'm here talking to Chantal David today, who is a licensed practical nurse. She's also been working as a colon hydrotherapist since 2002. She also administers IV therapy, vitamin and mineral injections, and foot detox baths here at VitaCare Natural Health. But today I'd like to talk to you in particular about colon hydrotherapy and how it can benefit aesthetics. So for starters, what are colonics and what is colon hydrotherapy?
Hi, Dr. Yam. So having colon hydrotherapy is the safe, gentle infusion of filtered water into the colon or large intestine, and it goes in via the rectum. And so it's about a 40-minute procedure where we're flowing water into the colon and allowing it to come out. So the colon has 3 segments to it. So it's recommended to do more than one, just to get the whole thing, because the colon's actually 5 to 7 feet in length if you're going to take the thing out of your body and splay it out. So yeah, it's a comfortable, many people wonder if it hurts. It's not painful. It can be a little bit of crampy, but that's about it. Most people feel really good after their treatment. They kind of float out of the room, and the receptionists are always kind of wondering why they're feeling so good. Yeah. So
is there any prep to do like before a treatment? Like, should you be eating certain things, drinking certain things? I don't know. I've never had one myself.
Okay, actually, that's a really good question. So on my website, I do have a section that has some prep work you can do. The main thing is to be as hydrated as possible when you come in, because that will help to soften everything and make it a little more comfortable. Also, not coming in on a full belly. So just sort of light breakfast. And I recommend people don't drink coffee the morning of their colonic as well. The other thing is to try to come in more of a relaxed state. So if you're stressed out from your day, sometimes we can be a little more tense. So it's nice to just prepare and just be relaxed. And also for after your treatment, maybe after your first treatment, just plan to have a calm day after. Once people have had a few treatments, sometimes they feel great and they just go right back to work after their treatment. But for a first treatment, it's nice to just book some time off for yourself.
Yeah, that makes sense. For any treatment that's new, it's probably a good idea to just chill afterwards.
Yeah.
This seems like a very specific and niche market to get into. How did you get into it?
Everybody asks me that. So actually, I was quite young when I did discover colonics. My older sister was living a vegetarian lifestyle, and she was living down in Boston. And so I went to visit her, and she told me she had this treatment. And I had this picture in my head of like an operating table and all this, but I went into I booked one while I was there, just because I was starting to explore all kinds of natural treatments myself, because I did have some digestive issues. So I booked one and I went in, and it was just this really nice, calm, spa-like room. And I was comfortable the entire time. So I had the treatment done. I only had time to do one while I was visiting her. I didn't know you could get it done in Victoria, which is where I lived at the time. So when I came back up to Victoria, I actually ended up doing a series of 6 treatments, and it was just a complete game changer. I was wanted to shout it from the rooftops. It's kind of a funny thing when you're feeling so well after having felt uncomfortable in your digestive system for a long time. So yeah, it was just such a game changer for me that I thought, I was kind of at the age where I was looking for what I wanted to do as a career, and nothing was sticking out to me. And the lady where I was having the treatment said, well, here's the info on the training if you want to go take the course. And I just jumped right on it and never looked back.
That's great. Now, you mentioned that you had some specific digestive disorders or some troubles. Do you have to have kind of digestive issues going on in order to warrant getting a colonic?
No, you absolutely do not have to. I think we live in a world that is just, we're exposed to many toxins. We probably don't eat perfectly 100% of the time. And even if we make the effort to eat really well, there's sort of pesticides and that type of thing on some of our foods. So you do not have to be having digestive problems. You can come in for an annual cleanse or a biannual cleanse. But another good question, yeah.
So what is the connection between, you mentioned toxins and the digestive system. What is the connection there between toxins in the intestinal system and the skin?
So our digestive system is where we absorb. It's designed to absorb nutrients and water, the last bit of water out of our foods. So if you think of some of the foods we're putting into our system are also not super clean. So our body's also going to be absorbing that as well. The other thing is that if you are not going to the bathroom regularly and stuff is starting to build up in there and ferment, that's when it gets reabsorbed and starts to go back into our bloodstream, which then actually sort of puts a damper on our other organs. Like our liver has to work harder because there's more toxins. And so then we can start to experience things like poor skin or lethargy, many symptoms resulting just from having this sort of toxic buildup, putting a burden on our system.
Right, that makes sense. So in terms of aesthetics in particular, what can you see as benefits from the colon hydrotherapy?
Well, I have 3 cases that I can think of where the colonics drastically improve the quality of the skin in 3 different ways. So the first one, and very simple, is just hydration. As I said before, the colon is designed to absorb fluid. In fact, that's how it forms a stool, is it's absorbing the last bit of fluid out of your colon and getting the last bit of nutrients. So when we are able to hydrate through the colon with colonics and sort of evacuate the colon and then hydrate it, you're going to see those results all over your whole body. So I have one case actually where I have a patient who was coming in originally for constipation. However, this patient has physical limitations that make it very hard to drink enough water physically. So upon observation, when she first came in, her skin was extremely dry, almost sort of flaky on her abdomen, and then very chapped lips all the time. So after her first colonic, she reported back after 24 hours, her chapped lips were gone. And then the next time she came in for her treatment, her skin quality was no longer flaky like that. So just as a way to hydrate people. It
Wow,
could even work that way.
that's a really fast results. Is that always the case that it happens that quickly?
Not necessarily. It was one of those phone calls that you got that was kind of like, wow, I wasn't even trying to do that, but that's super exciting and kind of makes you realize that connection, right?
Right. Yeah. How long would you say you usually see the benefits of the treatment?
Well, I generally recommend that people do the series of 3 to start, because there may be, after that first treatment, there may be some uncomfortable detox symptoms.
Hmm.
So
What does that
when
include?
so sometimes it could be a little bit of like flu-like symptoms,
Hmm.
maybe just feeling a little tired the next day.
Gotcha.
Yeah, mostly it's just a little bit of, it's usually just one day, not even of feeling a little bit tired.
Mhm.
So that's why I recommend to just give yourself some space for that healing time after the first treatment. But generally, it doesn't always happen that way. Sometimes people feel really good right away. But the odd time you get someone who really has a toxic load, and we're stirring that up by, loosening everything in the colon, and it's getting softened, and then it's stirring it up. So
Yeah, that totally makes sense in the case of someone who's been storing more toxins for longer.
exactly. And sometimes those are the people that do have the skin conditions, because it's been going on for a while, and their skin is trying to eliminate some of those toxins, right?
Yeah, I was just talking to or interviewing Dr. Holloway, and she mentioned the same thing, that there's this connection between the gastrointestinal system and the skin, and that the skin is just trying to get rid of all the toxins that are present in the body. And that often can manifest as things like discoloration and acne, et cetera, et cetera.
Exactly. I actually, that leads me perfectly into the next case. Um, it's a patient who was coming in to actually treat and heal leaky gut. And now that is a longer, so I talked about the series of 3 for some people, but in this case, treating and helping her heal her leaky gut was going to take, I think we worked together for about a year and a half. She was having regular sessions.
What does a
Um,
regular session look like? Is that once a week?
Yeah, for her it was once a week.
Okay.
Yes. I always base it on the individual and how they're doing. So it's not a one size fits all type of thing. But in her case, we were doing about once a week. And then we try, as we see things improving, we try to space that out maybe once every 2 weeks, and then hopefully just once a month, to kind of maintain. So this particular individual, she was coming in for the leaky gut. And I think about 4 to 6 months in, was starting to see a major improvement. Actually, it was going away. She had some eczema on her elbow, or inner elbow. So that's how she was sort of monitoring that. And as we improved her leaky gut, she was having her skin condition, her eczema was disappearing. So she made that connection. She was starting to feel better. And actually, it was kind of neat because she was getting married, and we had done so much work together. She was onto just like a maintenance type of regime. But she did not want to have that in her photos. So she specifically booked 3 colonics prior to her wedding day so that she would not have the eczema on her arm. And it worked.
That's
Super
amazing.
exciting to do
Yeah,
that for her. Yeah.
yeah,
So
absolutely. Um, so you mentioned another case. Do you want to maybe tell us about that last case?
sure. Yeah. So I had talked about how the liver can become burdened when your colon's full and your body is toxic. So it puts extra, extra burden on the liver. Um, Females do tend to detox their hormones through their liver. So one of the things, I was having a patient who had in her late 30s, and she was having hormonal acne. So every time, just after, before her period, she was getting these breakouts, and it was frustrating. So when she came in for colonics, she realized that when she had done her series of colonics, the next cycle, she did not have the breakouts on her face. So she was, that was like a major game change for her too.
Yeah.
So she's happy to see that basically cleansing out her colon helped her liver function better so that it could process those hormones.
Yeah, that's great. That's really, really great. I've also heard that, when there's toxic or toxin buildup in the system, then you end up having more age-related change in the skin as well. So more development of wrinkles and puffiness. Have you seen with your patients that there's any kind of aesthetic improvement that way? I heard or I read online that there's almost this reported a glow after a colonic.
I feel like it's the hydration.
That makes sense.
And just reducing overall inflammation in the body as a result of detoxifying. Right. What I have actually noticed, a personal experience, is that people would comment on my eyes more after I had treatments. And I think they look brighter, I think, because of the hydration.
Yeah, that makes sense. I also read online, and perhaps other people have as well, about the fact that there's other ways of doing colon cleansing. So where there's like, I guess, materials in the fluid that you would use. It sounds like that's not something you do. Is there a reason for or against that?
No, I do offer add-ons. So there's a few different ones that I use. So the one that I'm thinking of that could be really valuable for the skin is a coffee implant. And so coffee administered rectally stimulates your liver to produce more of an enzyme called glutathione. And that is a really great antioxidant, and it eliminates free radicals. It's anti-aging. So that's always nice. And it also stimulates your liver to put out more bile. So that helps it release more. So we'll do like a soak in the middle of the treatment. Okay. If a patient does want the coffee add-on. Some people swear by coffee enemas. Yeah, so they're pretty cool. Right. And then I also do chlorophyll. Chlorophyll would be used if someone was very dehydrated in their colon, because chlorophyll has a lot of magnesium in it, and the magnesium can help to draw moisture towards it and also to relax the muscles. So that's one that I can add on. And then
sorry, just one question about the magnesium one. How would you know if the colon is dehydrated or in need of that?
So oftentimes it would be people that are constipated. So they're usually on their intake form, they would indicate like, less frequency or hard bowel movements. Gotcha. So yeah, so I would usually the first treatment is a real assessment of how they're doing. And then we might discuss if they wanted to add on any of these things. And there would be different indications that would lead me to suggest one over the other.
Right, that makes sense.
The third one is it's done at the end of the treatment, and it's more like a retention enema. So basically the patient will get off the table. I'll give them some time to evacuate the rest of the water, and then they'll hop back on the table, and I will do an implant of probiotics. So that will stay in there. So we don't want to flush it out. It's to sort of improve the microbiome and the flora in the large intestine. So people that are wanting to replace their good flora and right directly into there.
Gotcha. Yeah, that sounds like a really interesting addition. I know there's a lot of research now on the microbiome in the gut, just influencing so many different aspects of health, and so much of I guess sometimes Western medicine has negatively impacted that. So if there's any history of taking antibiotics, that can sometimes change the microbiome. And it sounds like that enema would really help to heal after a course of antibiotics.
Absolutely. Yeah, it's amazing. We can help balance the body out with some of these treatments after
Mhm.
that type of thing.
Yeah. Do you find it's more effective than taking an oral supplementation with probiotics? What is the benefit of doing the enema versus supplementation?
I guess it sort of depends on the case. Like, I feel that if someone's absorbing well, yeah, and we're not necessarily treating them so much for dysbiosis, which is an imbalance in the bacteria in the gut. If they're just kind of doing an overall cleanse, then I might just suggest oral. But if it is someone, like you said, that knows they have had some imbalance in their flora, then I would maybe go directly just via the rectum instead, just to get right to the point kind of thing.
Right. That makes sense that it's more direct.
Yeah, there is another situation where I would do that also if someone has something called SIBO, which is small intestinal bacterial overgrowth. Then sometimes you want to just go right directly into the colon as well.
Right. That makes sense. And for SIBO, you'd have to get testing and diagnosed with that specific disorder.
That's right. So people could access that through, sometimes that happens where, the patient comes in for some colonics and then I have a suspicion. So then I'll recommend they go to one of the naturopaths at the office and get the actual testing and get the diagnosis. And then they can do some work with the naturopath around that as well.
Great. Do all of your patients have to go for an assessment with a naturopath, or can they just come directly to you?
That's a good question. Yeah, patients can just book directly with me, so they don't necessarily. Sometimes I will recommend after they've come in and they're seeing me, and I see that there's other things potentially going on. I will recommend that they do also see the naturopath, but to get in to see me, they do not need a referral.
Okay, great. And how would people get in touch with you if they wanted to book in?
Well, we can go through the VitaCare website, or you can come through my website, which is colonicsnanaimo.com. So there is online booking available, or you can just give VitaCare a call.
Great. Awesome. Well, you've answered all my questions, provided some great information. I appreciate that. Is there anything else you wanted to mention, or have we covered everything?
I think we covered more than I was expecting to cover.
Great. Okay.
Thank you.
Awesome.